The day is coming to an end, and my eyes are drawn to southern skies. But I'll be coming home soon. Yeah, I'll be coming home soon.
Hello, everybody. Nicholas Snow here. Welcome to Hot in Palm Springs on PromoHomo.TV. And it is hot in Palm Springs. We're going to have like triple-digit weather this weekend. This is going out on June 29th, 2023. And we'll be talking about important topics of particular relevance to people who live in the Coachella Valley. But as usual, this subject matter is fascinating and I think will be of interest to my worldwide audience as well. I'll be welcoming back to my show, I think for the fourth time, DAP Health's Director of Community Health and Sexual Wellness, CJ Tobe, to discuss the very important and progressive work that DAP Health is doing not only with harm reduction, but with recovery services such as their Outpatient Drug Free Program, peer support services, and I want to share more about their sexual health and wellness services, which I've covered in a couple of other episodes this month. And this particular episode rounds out my almost nightly broadcast for Pride Month. I will be taking a couple of months off, but throughout those 2 months, I'll be promoting a lot of the content that you may have never seen, and I'll be letting all of you know about very exciting plans kicking off in September. But stay tuned, because in 2 minutes, we're going to be talking about some very important life-saving issues. PromoHomo.TV is all about empowering you, our communities, and our world. For their support of PromoHomo.TV, I wish to thank my sponsors. DAP Health. I've been a grateful client of DAP Health for more than a decade. One of their value statements, we welcome all people, period. Willie's Modern Fare, 1501 Uptown Gastropub, and 849 Restaurant and Lounge. 3 restaurants, unlimited flavors. Shouting out to my media partners. Pink Media, amplifying PromoHomo.TV across the Twitterverse with their #ILoveGay campaign. David Perry and Associates, a PR and marketing firm. GayDesertGuide.lgbt. And KGay 1065 Palm Springs, available worldwide. Ask your smart speaker to play KGAY. And last but not least, the PromoHomo.TV superstars who voluntarily subscribe to the free content at PromoHomo.TV for as little as $1 a month. Join them at patreon.com/PromoHomo.TV. Meet many of them at PromoHomo.TV/superstars. Now here's how you can step up to the plate. To find out how you can help me empower you, our communities, and our world, visit PromoHomo.TV/empower. Thank you. So before I bring CJ Tobe on the screen, I just want to let you know how easy it is to find the information we'll be talking about today. So right now you're seeing my particular website, PromoHomo.TV, but if you go to daphealth.org, which I'm doing now, here in the top menu bars, you have sexual health. And if you click on sexual health, there's all sorts of information that is very valuable. But if you go back on the front page, one of the things that you'll also find prominently is information about the harm reduction program. So I wanted you to all see that just in case you don't get to watch the entire show today. And without further delay, let me welcome back to the show my friend and special guest, CJ Tobe. Hi, CJ.
Hi, Nicholas. How are you doing?
I'm good. How are you?
Doing good. It's definitely hot outside, that's for sure.
It is, but I've been saying to people in recent weeks, in which we've been in like the 80s and 70s and a little bit in the 90s, that it's felt like living in the Twilight Zone here. It hasn't felt like the Coachella Valley.
Well, we're in for a rude awakening this weekend because summer is definitely going to be here.
Yes, I gave my plant some extra water today. We have live comments already. So Lance Druckerman is wishing us happy Pride, and he is a regular supporter of my show along with his husband Gary. They're PromoHomo.TV superstars. And I have a viewer that I do not know, so I want to say hello to you as well. Thank you, Gay Angel. I'm going to just guess that that's how you pronounce your name. So, CJ, there's some things that have changed since you were first on my show. You know what they are?
What's that?
So, I've been a client of DAP for over 10 years, but then I worked as the temporary coordinator of the monkeypox hotline, and now I work at the Outpatient Drug Free Program. And coincidentally, you now are overseeing the program that I work in. So I just am pointing that out because I want my audience to know that our conversation is not advertorial. It's an interview. It's journalism. I get to ask whatever I want to ask, and there has been no agreement that I'm spinning the content of our show in any given way. So I just want to be very public about that.
And thank you, Nicholas. And it's great that you mentioned the MPOX response and how vital of a role you played, really kind of formalizing that hotline to make sure that there was a human on the other side of the line when people were calling, trying to get the most updated and accurate information, and all the volunteers that you led through that MPOX response. Again, thank you so much to you and the volunteer team.
Well, I know you didn't sleep much during those months, so thank you to you as well. So, getting to the hottest topic, I think, in our show today is the notion of harm reduction. So, I would love for you, for people that just don't understand it, or for people who may have heard things about it that are, stigmatic and not really true, to give us the 411. What is the harm reduction program as it pertains to DAP Health?
Well, the harm reduction concept, right? It's a principle, right, that people who are using drugs can incorporate into their lives to reduce the transmission of infection, but also to transmit the drug use as well, and how they can be safer with their drug use. And so, what harm reduction looks like at DAP Health, it's really about having the conversations with people who are, yes, using drugs, and building that relationship and establishing that trust to find out what their need is, to get them linked to their medical home, either here at DAP Health or any other services here at DAP Health or in the community. And so it really starts with that simple conversation, and then we start getting into what are the drugs that are being used? What does your practice look like? What are those social support services that you're going to need, whether it's education about how to properly use drugs, whether it's bringing in used syringes, or when we talk about overdose prevention, knowing that just here in Riverside County, about 15 people a month are dying from opioid overdose. We are making sure that we're distributing Narcan and naloxone into the community to help prevent death by overdose, and also providing fentanyl testing strips so people can test their drugs before they use them.
There are people that view harm reduction programs as enabling the addict. And if you could explain how that sort of has a cloud of stigma around it, and how that isn't necessarily the case.
Yes. So at DAP Health, right, you covered it in the opening. We welcome all people, period. And when you look at all the anti-trans bills that are coming out, you look at people who are using drugs that are being stigmatized. When you look at DAP, Yes, we are, right? We are enabling people through this harm reduction program, and it's entirely consistent with our organization's history and mission to end HIV, because we want to provide comprehensive healthcare and services to every single person through education, how to be safer, and how to live their healthiest, happiest life. And you can't do that by ignoring a person because they are using drugs, or ignoring a person because they're unhoused, ignoring a person because they have an infectious disease, right? We got to have these conversations, and I know it's a controversial topic, but a non-response right now, knowing that this has been a national crisis since 2017, and public health, DAP Health, all the partners are now fully fledged at committing to responding to this. We need to have those difficult conversations, and we do a lot of listening, right? Because everybody has different views on this program, and I personally am always happy to share and be very transparent about my personal view. And so when I started this work in Colorado back in 2014, working at a syringe service program, I grew up in rural Ohio with this belief and this assumption about drug use. But just working 2 weeks into the program in Colorado, everything that I thought through 20 plus years of my life was completely turned upside down when I saw a nurse coming at 6 p.m. after her shift saying, I've been using drugs since I was 11 because my stepfather was injecting me with heroin to make sure that I stayed asleep and he didn't have to watch me. And now this person was in their 30 and a nurse, and they felt horrible for their addiction to using drugs. And they wanted to talk to me about how can they not only be safer themselves, but how can they still use drugs but not put their patients at risk. And so this person over the next year went from using drugs 3 times a day to using once at night, which was after their shift. They were never high in front of their patients anymore. And so that's a prime example of what harm reduction is, because it looks different for every single person. And stories like this and those positive outcomes will completely change the perspective of people's mindsets and beliefs just by hearing this experience.
Now, you shared with me, and I trumpeted it out, that the overdose deaths in Palm Springs are 200% higher than the California state average. I trust you as a source, but what is the ultimate source of that statistic?
So there's several. One, it comes from the state health department for one, and then also the Riverside County also releases monthly surveillance data through it's called RODA, and it's Riverside Overdose Drug Association Addiction. And what they do is they release monthly surveillance data about opioid overdose and then even causes. So they look at how many reported cases, how many fatalities were there. Were people also coexisting with mental health challenges? And so through that data, Nicholas, I'm pretty sure that we've had this conversation, obviously, off the show, but we looked at data specifically here in the Coachella Valley, and we noticed that there was an uptick in deaths at hotels. And so we were able to work with the county health department to identify several hotels in the Coachella Valley experiencing the highest death rate, partner with them, and make sure that Narcan, naloxone, and fentanyl testing strips are readily available in their lobby, so customers can take those supplies with them into the room upon check-in, so nobody has to die. And that's the most important thing, is we have the medication, we have the tools to make sure that nobody has to die anymore.
Well, it's very powerful. You know, I had the opportunity to interview Neil Gussardo, who's one of the key staff in the DAP Health harm reduction program, and I decided not to air that interview because in the context of taping it, it wasn't live. I realized I personally had so much to learn, and it was pointed out to me that some of my views were stigmatizing. So I really wanted to take a step back. And one of my misunderstandings was that harm reduction is inherently a bridge for people to get into recovery, which is not the goal of harm reduction. Harm reduction is to treat people where they are and then to empower them to maintain their health and not to jeopardize the health of others, and to do so in a loving, accepting way. But one of the things that I actually learned, because I went to the event that DAP had as part of their Raw Talk series at Hunters earlier this week, there was a question that Neil responded to on the panel, in which he indicated that people that participate in a harm reduction programs are 3 times more likely to get into a recovery program.
That's accurate. And Nicholas, you know what? You have to engage with people, right? People who need us the most, we can't avoid offering a hand and a hug and anything we can give to somebody. The second we ignore people who are not as privileged as us or are going through a challenging time in life, that's the people that need our attention. Those are the people we need to build those relationships with. And yes, this program has been around for 40 plus years, right? So it's not new, and it's something that I know I've been having conversations now for 2 years with folks just to get the program up and running. This is not a new program. It's new here in the Coachella Valley, but nationwide, it's not new. It's been around for decades, and this program is needed. And it's been needed because people are losing their lives. We've seen an increase in HIV infections because of injectional drug use. We've seen an increase in homelessness and people losing housing through the pandemic. And so, any program that serves as a gateway to connect with people to say, you know what, we have an organization, an entire community that is here to accept you and welcome you exactly where you are at this point in your life, it changes lives.
Well, it's a beautiful thing, and it is, even though it's been around for 40 years, it's groundbreaking in our community. Thanks to you and your team and DAP Health and all the other stakeholders. So, because it's about to happen and a lot of people already know about it, let's break the news about the vending machines and where they're going and how they will be utilized.
Yeah, so first I really want to just talk about going back to like the why behind everything.
Yes.
Right? People are dying, and we know that there are testing supplies and medications that can save a life or at least prevent someone from dying until paramedics arrive. And so when you look at access, right? That's the biggest thing that I talk about all the time is about creating more access points for people to obtain the needed services to live healthy and happy, right? And so vending machines is a great way to be able to get that access in the community because one, you don't need physical staff, right? So that's great. And it's also going to be going into a business that we know people will be leaving and probably seeing things happening on the streets and in the alleys and hotel rooms and pool parties to make sure that they can properly respond to people and save their family member, their friend, their partner, or even a stranger on the street. And so in early July, we'll be installing a vending machine into a business on Arenas Street. And it's going to be a great service to the community. It's not going to contain any type of syringes or pipes or anything to do with injecting drugs, but it's all going to be about preventing overdose deaths and then also anything related to do with HIV testing. And I think that's something that's extremely important for people to understand is it's about saving lives.
Is there a particular reason why you're not mentioning the business at this time?
No, it's going to be Hunter's Nightclub. And they have been great partners this entire process to make sure that the machine looks great inside of the business. Having the conversations about what's going to go into the vending machine, the data that's going to be tracked through that vending machine, so we can leverage it to make decisions in the future. But to me, this is going to be one of many more that are needed. In my opinion, and also with other public health experts and then also city leaders about how we can get 24/7 access vending machines in the community, not in parks, not in libraries, but putting them strategically in places so people have access to this equipment to make sure that no more people die.
DAP Health is taking a broader approach to working with people that are abusing substances. I guess the term is substance abuse, right? Or substance use. So, what are one of the tools that you offer is peer support. The other one is the Outpatient Drug Free Program where I work, so I can clearly talk about that. But tell me about how these pieces connect and are part of the bigger picture.
Yeah, and I'll go all about to access, right? And go back to the examples we've already talked about on your show that everybody's journey, right, using drugs is going to look different. And it's going to look different tomorrow for the person that it does today. It's always changing. And so you want to create different ways to engage with people regardless of where they may be on their journey. So we talked about harm reduction. Those are people that are using. They got the access to the services to reduce the spread of infectious disease. They got life-saving medication and able to test drugs, making sure the use syringes are picked up the street and disposed of properly, and trying to get them into any medical and social support services. And then we have folks who are saying, you know what, I need to quit and I'm ready to quit. Whether it's forced because of employment, whether it's because something happened in their life and they're ready to try to make that change to sobriety, or maybe it's a pregnant woman, which I've recently have learned it's very prevalent of pregnant women that are using drugs and need some type of formalized program to put them through a curriculum and with experts to become and remain sober and what that life is like. And so when you talk about peer support specialists, these are folks that have those lived experiences. They've gone through using drugs and now through sobriety, whether it's smart recovery, whether they went through an ODF program or 12 steps. And so you can talk to someone and say, you know what, these are some of the things you're gonna be experiencing. These are the challenges, these are the successes. I'm here to support you. And what the peer support specialist also does is we have a great partnership with many recovery and treatment centers in the region. And so if somebody needs residential treatments, they will assess them with their insurance and then get them connected to get into residential treatment to begin their journey of sobriety as well. And
How do
then
people how do
yeah.
people access peer support?
So peer support, it's within our wellness program. So if you go to daphealth.org and click the wellness tab or social services tab, Bill Bruner is going to be our peer support specialist for substance use that you would come in contact with. And he's absolutely phenomenal to talk to. And he will have those coffee chats with you. You can do group stuff with him and really talk about experiences and learn from others. And he will also connect you to residential treatment as well.
Okay, so I've gone into the website, social services. So peer support would be where?
If you would maybe click case management, because that's typically where like referrals would come from case management, and that would be a
Okay.
service that would come from them, because it has to be a referral from either your doctor or a case manager, and so that's how they get connected into peer support.
Okay, great. So, what would you like to say about the outpatient drug free program? And then I can add to that.
Yeah. So the outpatient drug free program. So again, it's going to be for people who are ready and choosing right to become sober. And there's two tracks. One track is specific to men and chemsex, and the curriculum is called Getting Off. And you go through this program with Brendan Burke. And it's absolutely phenomenal. Brendan is one of the most amazing people I've met here at DAP Health. The way he goes about things and how he does it and cares for his people, and supports them through that journey. And it's individual counseling, it's group therapy, and then obviously outside services and support from DAP Health as well. And then track two is going to be really for anybody, regardless of race, gender, sexual orientation, who wants to become sober as well. And that curriculum is based on seeking safety. And that program and curriculum is going to look different. And it's going to be through Hans, who is other KDAC specialist as well. And there is not a timeline for this, right? So it's not up. You go through a program for 6 weeks, 12 weeks, and you're done. It's ongoing, and it's needs based on that individual and what they need.
The thing that I would add to that is that when someone is seeking to recover, they want to choose to stop, there are different levels of care. So there are people that need to go through a detox process first, and then that might transition into inpatient rehab, which might then transition to intensive outpatient care. The outpatient drug free program at DAP Health is the least of those, and for the people that need the least amount of support. So when someone comes to DAP and they're dealing with these issues, there is a process of of triaging the individuals and deciding what is the most appropriate resource available for them. But ultimately, whatever their bridge is to the decision to stop using and to seek recovery, whether it's through the harm reduction program or through a referral by their caseworker or primary care physician or even mental health therapist, ultimately they can end up at the Outpatient Drug Free Program as one of the options.
That's correct. There's a lot of pre-screening that's done, right? And then you got to meet with a licensed professional to get that diagnosis and get enrolled into the program. And talking about ODF, right, and harm reduction, I think it's really important to talk about the harm reduction program that it's been operating for 18 months out of the mobile unit. And just recently on June 5th, we were able to amend that syringe service license through the state health department to operate now at 1445 and sharing that space with the ODF team, where the ODF program is operating Monday through Friday during business hours, but then after hours, I believe it's now on Mondays and Thursday nights and then Saturday mornings, is the harm reduction program. And I think when you look at the patient experience of someone who may be going through the ODF program and hasn't used drugs in 3 months, but for whatever reason started using again, that we're not closing those doors on them just because they're using drugs again. No, the same doors are going to be open. You're just going to come access a different program, and we're going to work and help support you for whatever is coming in that journey that you want to do.
Fantastic. Now, there is another program that it's a federal program that I think you wanted to mention. And I don't remember what it's called, but there's this cute little acronym, and it's DAP, I guess, is honored to have been chosen to participate.
Yeah, DAP Health, we're so grateful. We have been recipients of several national projects in the last couple of years, and we're starting to see the outcomes from some of those national projects and how they are really, really supporting the health and well-being of people with HIV specifically. And this national project is no different. And so this is based on the Max Clinic intervention that was founded in 2015 in Seattle, Washington. And it's now been a proven effective model to where HRSA, the federal government, has now found implementation sites across the country to implement this proven intervention. So what it looks like at DAP Health is we've had to rename it. So it's called the Midas Clinic, and it stands for the Maximum Intervention by DAP Health's Array of Services. So it's the Midas Clinic. Our lead clinician is Dr. Vu, and our case manager is Adriana Cano. And the core components of why this intervention is so successful is it's high intensity case management. So it's not, we're going to see you once and we'll talk to you in 3 months. It's, we're going to see you 5 times a day and talk to you 12 if that's what it's going to take. We also do incentives. So any incentives that you can think of as far as track phones for communication, Lyft rides, food for food insecurity, anything that you can think of to help address social determinants of health. That's what that program does. And then also we know that you and I, right, you live across the street from DAP Health. I'm really right around the corner as well. We are not facing social determinants of health in our lives currently that are preventing us from coming to our medical home, but many folks do. And so people who are using drugs, people who are unhoused, people who have food insecurity, healthcare is not a priority for them. Keeping appointments, it's not a reality right now for them. And so this intervention, it opens the door to allowing drop-in access HIV care with that clinician that they've already built a relationship with. And so that's what this intervention is about. It's about people living with HIV, with substance use disorder, and providing that high intensity case management, those incentives, and that drop-in HIV access.
Well, it's all amazing, and I'm really glad that we're talking about this in a way that people can watch again, because we're sharing so much information. Now, one of the things that I've done this month is I did a comprehensive episode about PEP, which we'll talk about in a moment, and the other episode that I did with a member of your team was about PrEP, These are sexual health and wellness services. But before I ask you to give an overview of the available services, I just want to let our viewers know that if you go once again to the main daphealth.org homepage, the the top the top blue row has a sexual wellness services link, and then this whole row of colorful buttons has a sexual health link. And when you click on it, you can find the array of sexual wellness services that are offered not only in the Orange Clinic on the DAP Health main campus in Palm Springs, but also in the Indio Clinic. And the services, not necessarily some of the medications involved, but the services are all free. So correct anything I may have said that's not true, but give in the remainder of our interview just anything that you'd like to say about the services that are offered.
Well, what I first want to say is we have some of the most amazing, mission-driven, compassionate, non-judgment-free staff that I have ever worked with in my professional career that's currently working in the Orange Clinic and the Indio Clinic. And yes, all services are completely free. So if you need an STD or STI test, if you need treatment, if you need PrEP or PEP to prevent HIV, and then also there's PrEP and PEP, right, to prevent some STDs as well, come see us. And just most recently, we've formalized birth control and pregnancy testing completely free as well in our sexual wellness clinic. So please visit the website, find out where we're located, call 760-992-0492, get an appointment. We're here to take care of you. Come see us.
Well, fabulous. Now, I just wanted to share, I'm living with HIV. I'm very out about that. That's not new information. I've talked about the fact that because I'm successfully treated on an antiretroviral medication and I have an undetectable viral load, that I cannot transmit HIV to my sexual partners, and I like to get out the U equals U message. One of the things I did not know about until I had Trent Broadus, the nurse practitioner from your team that works in both the Orange Clinic and the Indio Clinic, come on my show, is PEP, for pre-exposure prophylaxis for common STDs like chlamydia and syphilis. And the way that it's administered, and there's a whole episode about this at PromoHomo.TV for the viewer, but basically I've made my PEP appointment. So I'm going to go in, I'm going to have a half an hour consultation, I'm going to learn about the process. They're going to screen me for existing STDs to know that I'm starting off in a STD-free place. And then I will be given a prescription for doxycycline. Is that what it's called, doxycycline?
Yes.
And the way that it's used, if I have a sexually active night or weekend, then the morning after, I would take this medication as prescribed. And it has a high efficacy for preventing both syphilis and chlamydia. So I'm excited to know that exists, and I'm taking advantage of it myself. But you were stating that interview on my show was one of the first sort of public messaging that DAP Health has done about this.
It is, and I'm happy to be completely transparent and share with you too that we've been doing. It's called Doxy Prep, right, to prevent the syphilis and chlamydia, and some studies have shown gonorrhea. That we're doing this in the primary care setting back in June of 2020, specifically to patients who have had a history of multiple bacterial STIs, and we did that in response to COVID. Knowing that people were still going to be having sex, even though we were basically on shutdown for quite some time. And so that was something that our clinical team decided to do and start offering that to patients with a history, right? And have that conversation. And then now, just most recently, it would have been last summer, during a conference, there was a lot of more updated research data that was showing the efficacy and how effective it was for PEP. So PrEP is going to be that 100 milligrams once a day, and then PEP is going to be 200 milligrams within 72 hours after sex. And so it's going to end up becoming one of those alternative dosing strategies and methods to basically battle a syndemic, because we're continuing to experience an insurmountable high of STDs here in this region. And so when you look at what can we do outside of education, risk reduction practices, condoms, pulling out, we have medication that can help prevent some of these bacterial STIs.
Well, thank you, CJ. I know you have an event to go to, so I don't want to keep you longer. Is there anything that you would like to say about anything in conclusion?
Two things. One, thank you for having me and all you do for DAP Health in the community, getting some of this most important information out to people. And then I just welcome anybody to please contact me if you want to have a conversation about unmet needs in the community, additional questions or follow up. If I'm not the best person to talk to, I'm happy to connect you to other people. And my email, cjtobe@daphealth.org. Feel free to reach out to me. And I just want to say, if you need care, if you need compassion, if you need medical services, if you need a hug, come to DAP Health in Palm Springs or Indio, and we will take care of you.
And because I'm fast, that's your email right there on the screen, cjtobe@daphealth.org. Thank you, CJ, and I hope you have a great event tonight. I appreciate you coming on the show, and I look forward to having you on the show many more times.
Thank you so much. Always a pleasure.
Have a good night. You don't have to hang out for me to talk to me after the show. Have a great event.
Thank you. Have a good night.
And for those of you at home, thank you so much for watching. As I mentioned, I'm taking a break, but there's still lots of content on my show. If something major comes up that I just really want or choose to cover, I will. But I'm going to be behind the scenes doing a lot for some exciting expansion and changes that will be unveiled in September of 2023. So until then, thank you for watching.
In a safe place, I got room to breathe. Been a long chase, but at last I'm free. These open woods, I knew I could find peace here. Nothing like the city where I got tired of the running, the catching up. I got hungry for the stunning high mountain tops. So I made some plans, some dreams to catch, to promised lands, to find my path. See the planet from greater heights. I have found a place out of time and space, far from city life, up on greater heights. See the blue sky, feel the wind that blows. Get the rush in, heaven only knows. I'm all alone, still lying far from lonely. On a journey, on a winding road. Got tired of the running, the catching up. I got hungry for the